Thank you very much. I thought we'd start this evening with talking about the COVID situation before we move on to other things. So I'm going to talk a little bit about how we see the COVID pandemic playing out, not over 1 year, but over the next decade. And then we'll talk about the issues that we've been asked by Auckland Unlimited to look at, some general issues about the positioning of Auckland and where it might go, the opportunities and the challenges, and then talk particularly about the innovation dimension of that, and then finally about the social and human dimension of that, and try to bring that together in the work that we've been asked to do. So, as Rod just mentioned, I'm President-elect of the International Science Council, which is the global body that represents both the natural, social sciences and indeed a number of the humanities, and which is the body that the United Nations recognises representing science and its broader dimensions in the world of multilateralism. And late last year, when the vaccine started to be available and politicians started putting out the message, it's all over, we have the vaccines, it's all over, life will turn back to normal rather rapidly. We had a discussion amongst ourselves and with a number of very distinguished people, and we decided it was important to actually have a scenarios project that looks ahead what's really likely to happen and how decisions made in the next 12 months might impact on how the pandemic evolves. And that ended up being a partnership with WHO, the United Nations Disaster Risk Reduction Organisation, and the International Science Council, on a project which I lead or chair the oversight of. Some of our team are directly involved in it, but involves on the oversight board some of the world's most distinguished epidemiologists, some of whom you've seen on CNN and other channels quite a lot, and involves some of the world's leading economists, or some of the world's leading social scientists and political scientists. And it's keeping me awake an awful lot, a lot of Zoom calls every night. And we're thinking about in terms of 5 dimensions. And I think we need to recognise that this is a multi-dimensional problem that we face. The first dimension is actually the easiest to understand. It's the biological dimension. We have a virus. It's going to continue to mutate. It is a virus. If you had to design a virus which was going to cause a pandemic, it is almost the perfect virus you would define. Long, significant asymptomatic incubation period, doesn't kill everybody, spreads very rapidly, and it mutates quite easily. So we have the virus, and with a large population infected, it will continue to mutate. Some of those mutations will matter, some of them will not matter. Then we have the vaccine, and the vaccine works now, or at least the Pfizer vaccine and the Moderna vaccines work very well. But we have issues of production, we have issues of supply, we have issues of changed efficacy against disease, how long will the vaccine last, the duration, etc., etc. And it's not without cost. You see, the government pointed out today they're going to spend well over $1 billion on the vaccine. We can afford to. Many countries can't. We can afford to when we have to revaccinate at some unknown time in the future. Many countries will not be able to. At the current rate of supply and production, the world will not be vaccinated before 2024. And even that may be optimistic if recurrent vaccination is needed. Furthermore, we have a problem of hesitancy. Recent Australian surveys suggest that only 70% of people will get vaccinated. Japan, it will be likely to be 50%. France, less than that. And so we have a problem that while we as a country with a high level of social trust will probably achieve high vaccination rates, many countries will not. And that, of course, has implications for how social measures can be changed. Because what the vaccine is doing, and it's become very apparent in Singapore and Taiwan in the last 2 weeks, is The vaccine will stop you getting sick. It will reduce your chances of transmitting the virus, carrying the virus and transmitting it, but it doesn't obviate it altogether. And so at some point when borders open, it is inevitable the virus will come into the country. Inevitable. There's no way around that. Even if everybody coming in is vaccinated and if everybody's screened with rapid testing, probably the virus will still get in. And if you just do the sums on if only 90% of the population get vaccinated, that still leaves 1 million people unvaccinated, or at least 700,000 adults unvaccinated, of which a number of whom will be vulnerable people. And that leads to the giant political dilemma I'm going to come back to in a moment for a country like New Zealand that starts from a low viral burden situation. How do you move a population that's become paranoid about one case of the virus occurring to one accepting that there will be cases, like there is people die of the flu every year? That is going to be a very hard political and social discourse. Very, very hard indeed. And we should not underestimate what that will mean. And so if you think about where this is going to go, you have countries now with high viral burdens, like United States or Europe, that can afford to vaccinate their way out of it if the people comply. You have countries like New Zealand that have low viral burdens and can afford to vaccinate to a level of high levels of resistance, but not absolute protection. And then you have low-income countries that have high viral burdens and will be years away from being fully protected. And countries like Vietnam that have low viral burdens are poor, and what will happen to them? How will they maintain their low viral burden state? And yet at some point in the future this has all got to harmonise if you are ever going to return to free travel without all the issues around it. Very complicated. And that's easy compared to the next dimension, which is the social dimension. So at the best will in the world, we're going to be thinking about this virus from a point of view of the medical, evolutionary, vaccine, movement point of view for another 4 or 5 years, in some level or another. How it happens in each individual country, of course, is going to depend very much on local decisions that are made, largely about the acceptability of it becoming endemic. The second issue is the dimension one. We've already seen so-called vaccine fatigue, where social measures are being resisted. We've seen the confusion of ideology and social measure compliance or resistance in a number of countries. Will you mask or not has become a badge of political statement in some countries. Then we have a large number of issues around families that have been subject to social disruption. New Zealand perhaps less than many countries where the mortality and morbidity rate has been very high, but then yet that doesn't mean that there have not been people who've failed to get to funerals, failed to get to a wedding, etc., 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 because of what's gone on. But I think mental health is the one we must think about more and more. We know now in Christchurch the burden of mental health is double that, or mental ill health, double of that which it was before the earthquake. That may not apply to every New Zealander, but a lot of New Zealanders will have been made more vulnerable because of what's happened over the last year. And the most vulnerable group of those are young adolescents or adolescents who've had their schooling interrupted, their career choices interrupted. And we already have a major problem of youth mental health, which this country refuses to acknowledge and act upon. 35% of Maori and Pacifica young women of school age are mentally unwell, do not have optimal mental health. 25% of young Maori and Pacifica men do. 25% of young Pākehā women, the same. So you can't have a society with those levels of burden. The rates would half that a decade ago. We need to think seriously about the issues ahead of us. Educational disruption is a huge issue. The experts like Stuart McNaughton will tell you that particularly those people at the late school years, will never fully recover the deficit that's been created by the interruption in their training and schooling. And then, of course, all of us know about the small business owners, the tourist operators, the pilot, the air travel, the travel agent who've lost their careers and are not going to rebuild them in a hurry, their businesses. We've also got a changed rate, and remember I'm talking here globally, not just about New Zealand, about the increased rates of welfare dependency around the world. How will countries exit those? And I think that we are seeing already that COVID is a catalyst for disrupting social cohesion in a number of societies. You put this all together and you can see a decade ahead in which the social echoes of COVID will persist. I'm not going to talk a lot about economics because it's not my strongest suit. But again, at the economic level, we've got the microeconomic changes which I've largely talked about. But I also think the consequence of the K-shaped political recovery, or economic recovery, is going to be a greater focus on the issues of inequity. I think there's no doubt that those issues were there before COVID. They've been exacerbated by COVID. And I think we're seeing the start of a discussion about a change in the political economy across the democratic countries. There's also a shifting global focus which will impact on a country like New Zealand of shorter supply lines and so forth. At the macroeconomic level, quantitative easing probably will not be a huge issue in a country like New Zealand. It might have a small inflationary effect, but the real issue is going to be debt and debt, particularly in countries of middle-income countries, which have gone into debt to cover with vaccines, and how that may play out in terms of triggering some economic downturns is something the economists are quite worried about. At the governance level, and I'm going to move quite quickly because of time, there's an interesting phenomenon going on. We've seen a greater interest in the use of autocratic processes in Western democracies. So we've seen a reduction in consultation. It's extended well beyond COVID emergency into other areas of decision making, and there's quite a lot of concern about that. And when you add to that those countries that have not done well, unlike New Zealand, which has had a rise in trust in government in the last year, you've seen in many countries a rapid decline in trust in government. And of course, there are people making mischief against that background with disinformation campaigns. And the political scientists are very worried about the future of democracy in this context. Again, plays into social cohesion. And then we have the geostrategic clock, which has already been in play. Right from the outset, geostrategic issues interfered with the pandemic being managed properly in the acute phase, certainly by China, but also by the World Health Organization. And we happen to be in a situation, a phase globally, where multilateralism was already weak. And sadly, it's not been strengthened in the last year. And I think the issues for us in New Zealand around a weak multilateral system, because we rely very much on a rules-based global order, are quite worrisome. Will it be responded? I think will it be repaired, enhanced? I'd like to say yes. Do I think it will? It's pretty uncertain. I mean, all said and done, we're a year and a half into the pandemic. The United Nations has not met once about it. The Security Council has not met once about the greatest existential risk the world has faced. There are real issues here. It's also been diversionary, allowing other regional issues to blow up. I think we're seeing one at play in the Middle East right at the moment because the major player's mind has been elsewhere. So where does all of that lead Auckland, New Zealand's gateway? Well, we're caught in this conundrum of when will the borders open up? And if you think about it, it's going to be dependent on vaccine uptake by New Zealanders, particularly in our vulnerable populations, Maori Pacifica, Asian migrants. They are the vulnerable populations that will need to have high vaccine coverage before we dare really open the borders. The government has been repeatedly clear that it is nervous about vaccine efficiency against transmission as opposed to disease. And that remains a conundrum, but with rapid testing, particularly rapid saliva testing, anterior nasal swab testing, it is possible to see regimens where triage at the border, rapid testing, short quarantine could be done. But there are two things that we need to recognise. New Zealand lives in a risk-averse environment. It has been promoted innocently, and I think I'm not being critical, in the COVID era. We've seen one case causes flat panic at every level. And so we have two things. Politics with a small p, which is how society operates, and politics with a capital P, that are going to have to handle this transition from epidemic management, which is what we're doing now, with tight shutdown of the borders, to endemic management, where we accept there will be cases across the border, but hopefully enough people are vaccinated that the burden of the disease breaking out is minimal. But it comes right back to this point that the ability to move is both, on the biological side, it's easy. We could vaccinate everybody and then we wouldn't have a problem. The problem is not everybody will get vaccinated, and therefore some really complicated political issues ahead. And that's the dilemma that faces Auckland as the gateway city. How will this play out over 6, 9 months, 2 years? It's going to take time. I mean, at the rate we're going, we still do not know the level of vaccine hesitancy that will actually be at play in, say, South Auckland or West Auckland or East Auckland over the next 6 months. That is going to be the critical issue which determines when the government decides to move. So I'm going to stop there, just open it up for any questions on the vaccine before we move on.
Thank you very much indeed, Peter. Any questions on that vaccine and pandemic outlook? Can I just add one, if I may? It's this very interesting point, a very crucial point you're raising about New Zealand adjusting to more cases as the border opens. Can you offer some ways in which we could be working on that problem and beginning to encourage people in that view that this is necessary and inevitable?
Well, I think the first thing is to talk about
it. Oh, sorry,
I think the first thing is to talk about it. What we have not done in New Zealand in the last 6 months is talk a lot about these issues, which should be self-evident that there's trade-offs in all directions, and there's no real discussion going on in the public domain in which the discussion is other than we have made the decisions, this is what we're doing. So that's one. I happen to do the peer review for the Irish government on rapid testing. And while they're coming from a different perspective from us, because they're coming from a moderately high viral load to a low load, they're putting in place an enormous amount of rapid testing as a way which can be done quite cheaply, probably at scale, $5 to $10 a test, 20-minute turnaround on it, turns out to be very accurate. It can be even done at home, as you know now in America, there are now home testing. And what they're doing is they're putting it everywhere, into schools, into shopping centres, everywhere, just to try and keep the levels at the low level they're striving to get. If you think about it from our point of view, we should be introducing the norm of rapid testing early, so that as the border starts to open, the places where that is where we're going to pick it up and keep it under some sort of control. Again, if we could get the vaccination rates really high, this would be a lot easier to deal with. And then there are other decisions which we have to come to. are we only going to let vaccinated people into New Zealand? If so, what vaccines counts as being vaccinated? If you take, I don't, probably none of you are reading the COVID story as like I'm having to read it, but look at the Seychelles, the country with the highest rate of vaccination in the world. But unfortunately, it was a Chinese vaccine which had only 50% efficacy, as it turned out. And so they've had a massive outbreak of a massive outbreak of disease. They thought they had done the right thing. They had vaccinated virtually all their population. It turned out to be a lousy vaccine.
Any other questions or thoughts, Peter? I'm just going to add one more, if I may. You quite rightly laid out those 5 dimensions, many of those issues there being extremely challenging. But do you think there are some aspects from the pandemic and the way we've responded that are actually positives?
Yes.
As we work through these issues? And what would be on your mind there?
Well, funnily enough, on my mind immediately comes climate change in a funny way, because I think that this has been the biggest existential threat anybody alive today has faced. And it's a real existential threat. It's shown the multilateral system is weak. It also showed the national systems were very weak. I mean, if you look at what has been said to virtually every government in the world by people such as myself and Anne over the last few years, high risk of a zoonotic pandemic. Very high risk, inevitable. We've actually had a number of close calls with MERS, SARS, etc., etc. It was inevitable it was going to happen. Some of you may have seen Anne and myself recently released a report on New Zealand's risk system. The risk system in New Zealand, risk assessment, risk management system is weak in public governance. It's no better in most other countries. This is actually where the action has to take place. The third thing, which is really important, Rod, is, as I mentioned, the weak state of the multilateral system. And that's where Helen Clark's report is very valuable. It's not, I wouldn't say it's the only possible solution, but it's a valuable impetus that we do need the multilateral system, and maybe with Biden taking over from Trump, there is an opportunity for that discussion to take place. But it's difficult. It's very difficult to see how we would get reform of the multilateral system. My own view, and Helen Clark's report also goes there, and we've been doing a lot of work on this indirectly with her, has been we need an independent pandemic management agency at a global level that can actually has the powers of, no different to the Office of Chemical and Biological Warfare or any of those kinds of organisations. Otherwise, we're not going to get on top of it.
Thanks. Look, there is just one question. There is one question here which I'd like to ask that's come through on Slido. With shorter supply chains, do you see this impacting on our export markets?
Yes, I do, and I'm not sure whether Anne's going to talk a bit about that in a moment. But I think, and those of us who've looked at business commentary, as Rod's looked at it far more than I have, over the last 12 months, will see around the world there's issues of moving from just and now to resilient supply chain thinking is going on all over the place. And one of those things is shorter supply lines. And that, I think, to what extent it will affect us, I don't know. It's already affected us in one way. Export education will never go back to what it was. And export education is a form of a different kind of supply line. But we're going to do export education only by exporting electronically more than importing people. There's no way around the world that export education will return to where it was.
Fine, thank you. Now, so that's you for this first section, and now we're going to hand over... Oh, sorry, yes? Patrick, yes. Hang on a second. Microphone is coming to save you getting up. Yeah, okay, just so we get this on the video. Thanks, Patrick.
Thanks, Peter. Is this on?
Yep.
Could you expand a little more on the lessons from COVID on to the climate emergency?
Well, yes, because I think what has been learned in that is that the relationship to evidence and policy making and politics has had to be adjusted rapidly in COVID. Can those lessons be sustained into the climate change, I don't know what we want to call it, the catastrophe on the way? Can the fact that the multilateral system at some levels, I've been critical at some levels, but at some levels it worked very well. I mean, the way the vaccines were produced rapidly by scientists across multiple countries, and both the public and private sector, particularly the private sector, coming together was very effective. Can those lessons be learnt to actually find ways to strengthen the way UNCCC, etc. work? I mean, rather than just being big conferences, I think the specifics of producing a vaccine showed what technologies can be developed rather rapidly if you move fast. Can we do that on other areas which would be relevant to climate change?
Peter, it's Michael Quinn. The piece that you presented there on the transitions, it seems very complex, and it's good to bring up. It's more complex than I thought it was. There's a lot of people who are keen to open the borders as quickly as possible. There's a lot of businesses that are reliant on that, and there's a lot of communities who are really worried about those borders being open. So on those transition issues, have you got a view on when we should start that conversation? How we should do it, and who should be doing it?
Well, I think the first thing to do is the talking has to start, because it's inevitable at some point we will have to open the borders in some way. There are ways we could open the border more now, with rapid testing, with shorter periods of quarantine, with traceability on people. I mean, I need to travel to Paris, let's say, to the International Science Council. I'm vaccinated, I have a test, I come back, I'm negative, I go into self-quarantine for 5 days with further testing. But I have to wear an ankle bracelet to show that I am in self-quarantine. If you don't want an ankle bracelet, you go into a hospital, into an MIQ, and you pay for it. There are systems that, I'm making that up, but the point I'm making is there are intermediate steps if you think it through, and you think it partly depends where you're coming from. Clearly, if you're coming from India, we've already got different rules in place, so if you come from the Cook Islands or from Australia. But we've seen with Taiwan and with Singapore that if you don't have rapid response systems in place and are willing to respond quickly, you're back, and you don't have everybody vaccinated, you're back into the community spread issue again. And so that's the dilemma. And I think until you come back all the way, yes, you could open up a bit, as we have for Australia, as we might be able to do in Singapore in a few months' time or Taiwan. But you come back to the risk profile, as New Zealanders see the risk profile of this disease, is unacceptable until you get a very high vaccination rate. And that's the situation we're in, because we're coming from a low viral exposure into an environment of accepting endemic exposure, which is very different to going from London or Paris or Munich, where you're going from a high viral exposure and you're going down and you're accepting, and there's a different acceptance in the population of priority. And we've just got to accept that there's this fully understandable, both big P and little p, political dimension to decision making. But the best thing about all of this is discussion. Makes it easier for the politician.
I'm sorry not to turn to you, because we've got a complicated programme tonight, and I'm trying to keep more or less on track. But don't worry, there's going to be a catch-all session at the end. So hold that question for now, thank you. Now, in this second leg of the presentations, it's a great pleasure to welcome up to Dr. Anne Bardsley, who is the Deputy Head of COITU, and before that was the Chief Analyst when Peter was Chief Science Advisor. Very warm welcome for Anne, please. Thank you.